Is tympanometry a precise and quick test for ear health? Imagine a simple test that can tell you a lot about what's happening inside your middle ear in just a few minutes. That test is called tympanometry, and it is widely used by healthcare professionals to assess ear health. Tympanometry is considered a reliable and efficient way to evaluate how well your middle ear is functioning, especially the mobility of the eardrum and the status of the ear's air-filled spaces. It helps detect issues like fluid buildup behind the eardrum, perforations, or problems with the Eustachian tube, which can all affect hearing. The test is very quick, usually taking only about 3 to 5 minutes. It involves placing a small probe into the ear canal, which gently changes the air pressure inside. The device then measures how the eardrum responds to these pressure changes. The results are displayed as a graph called a tympanogram, which audiologists and doctors interpret to understand the condition of the middle ear. Because it is non-invasive and requires no special preparation, tympanometry can be performed on people of all ages, including young children and infants. In terms of accuracy, tympanometry is highly reliable. Studies show that it has a success rate of between 74% and 94% for obtaining useful clinical results. It is especially good at detecting middle ear fluid and other conditions that can cause hearing problems. Its sensitivity and specificity are often above 90%, meaning it is very effective at correctly identifying middle ear issues. However, in infants under 7 months old, the test can sometimes be less accurate because their ear canals are more compliant, which can affect the measurements. Tympanometry is a valuable tool that complements other hearing tests like pure tone audiometry and otoacoustic emissions. It helps healthcare providers make better decisions about ear health and hearing loss. But it is important to remember that tympanometry only assesses middle ear function. It does not measure hearing sensitivity directly or detect sensorineural hearing loss, which involves the inner ear or auditory nerve. Conditions like earwax blockage or perforations can sometimes interfere with the test results, so proper probe placement and calibration are essential. Overall, tympanometry is a precise, quick, and useful test for evaluating middle ear health. While it has some limitations, especially in very young children or when there is ear canal obstruction, it remains a standard part of ear and hearing assessments. If you have concerns about your ear health or hearing, it is always best to consult a healthcare professional who can interpret the results in the context of your overall hearing health.